of this video is prior to moving a ventilator patient to a chair. There are certain areas that we want to assess to ensure a safe move. The first item, we want to make sure that, God forbid, if anything goes wrong, that we have our ambu bag and it's in the flow meter and we have it at 15. The second thing that we want to make sure is that whatever airway the patient has, if it's the ET tube, this is the anchor fast, tight and secure. You want to make sure there's only 2 fingers slack underneath the neck. If it's a trach, you want to make sure that the trach ties are snug and that you can only put 2 fingers. One issue that we have sometimes is due to patient comfort, we might loosen up the tie and all that extra slack is underneath the neck. So make sure that we assess and there's not that extra slack. Okay, as you see, the ventilator is set at 500 and the patient is exhaling 499. The reason why that would be important is that once we do the move, if this drops to 250 or 270, then we want to make an assessment to ensure that we have not lost the airway and we have our ambu bag ready. The other item is that we want to check the T mark on the lip and remember where that is. On the purpose of, as we move, if the tubing is snug, if we happen to pull the airway, and once we put the patient in the chair, if it's not at that mark, then we'll have to assess. The one thing that we want to do prior to and afterwards is ensure that there's good chest expansion. We listen for breath sounds and we're looking at the monitor to ensure good O2 saturation, heart rate, and blood pressure.
Okay, so we're walking in now to prepare for a transfer with a patient that has multiple lines along with a vent. So as you can see, there's a lot we're going to be dealing with, so we're going to immediately start assessing the situation. I already know just by looking at everything that's with the patient, I'm going to need some assistance. But before I even grab my assistance, let me get everything ready and get the environment prepared as much as I can before doing that. So if we have a responsive patient, we want to get the patient or perform a transfer that's going to lead to the patient ending up in a chair. Looking at the environment now, it's not in the best position, but we have multiple things we want to do as far as getting all the lines on the same side. As you can see, the vent is on one side, IVs and multiple other lines on the other. I want to stay away from mobilizing the vent, so we want to bring everything towards the side of the vent. So let me start now by getting this chair out of the way. And now I want to kind of just assess the patient so I can have room to do everything I need to do. I want to come behind the vent and I want to search and make sure we have adequate room if need be to get back here for any kind of emergency situation. I'm going to assess the ambu bag and make sure that we have one that's present in the room and that is set to 15, as this one here is. Now I want to assess the patient and the lines itself. So I'm looking at the tubing. I want to check how it's fastened. I want to use a 2-finger rule that we know about. Make sure I can only get 2 fingers in there, which I can. I'm looking at the patient, watching for chest rise and breathing, which I see. I'm also assessing the patient's vital signs on the monitor, making sure that those are adequate enough and ready for the patient to be transferred. I then want to direct my attention toward the vent settings. I'm looking for 2 key things, the volume settings on both sides. So I see the volume here, the target is at 500. And I come here, I see that 500, 501, that's a good setting. As mentioned before, as we perform the transfer, if we see a drop at about 250 or 270, we want to make some readjustments and reassessments. I also want to check the number settings on where the tube is here. Keep that in mind so that after we perform the transfer or each transfer, we make sure it's at the same place. If it's moved, we want to reassess and get it back to where it needs to be. So I see everything is fine here. Before I even get ready to loosen the slack here, I want to just leave that alone for now. All these lines going to the correct side before I manage these. So let's tend to these IVs. These are already unplugged. So we have everything unplugged here, we have everything set. Untangle if you need to with any lines that you have, just to make it easier. And let's start getting these all towards the same side. Keeping the IV pole as close to the bed as you can to not dislodge any lines. All right, I currently have all the lines going the same direction. I'm free from any tangles. No lines were dislodged. And I want to now reassess the patient again, checking the vital signs, make sure it's still okay. Looking at the breathing, breathing is still fine. Nothing was changed here with the breathing tubes. So now I'm ready to begin with getting help, the assistance that I need to begin this transfer. Knowing that we have a vent, I want to speak with the nurse and getting the respiratory therapist involved as well. I'll be right back, Mrs. Doe.
Hey, how are you doing, Raymond? Are you the nurse for this patient?
Yes, sir.
Okay, I was getting ready to perform a transfer from the bed to the chair. However, this patient has multiple lines and a vent, so I wanted to know if I can get your assistance.
Yes, not a problem. Let me just get the RT for you.
Okay, perfect, thank you.
Oh, great, you guys are here. Come on in. So what we're trying to do now, we're going to try and transfer Ms. Doe from the bed to the chair. We have multiple lines, and we also have a vent set up. So we're just going to try to coordinate and get this transfer as safely as possible. Okay. So I've been assessing the patient. I see the patient is breathing. I'm watching the chest rise. I've already assessed the breathing tube to make sure that it's secure. I got 2 fingers in there. I've already checked the number to where the tube is set. We went around and checked for the ambu bag. It's set up and it's at 15 as well, and the volumes are matching up as well.
Excellent.
As we begin for this transfer, we now want to assess the environment and make sure everything's set and communicate with everybody that's assisting so we're all on the same page. So that's what we're going to do now. Just going to move these sheets down. Want to remove any excess lines that you don't need, which are some of these here. Just place these off to the side so they don't get in the way. Okay, so as you can see, I want to move this chair back to its optimal position where we want it to begin the transfer. Similar to our other transfers before, we want to keep the same wedge look here, but still have adequate room to allow for the patient to sit at the edge of the bed following our supine to sit transfer. I'm not locking the chair. Okay, do you have enough room right here?
I will double check. So what I'm going to do is I will assess the length once we get them to the side of the bed and dangle.
Okay. And after we finish the supine to sit transfer, I'm going to have you positioned here, so you're in a good position now. Thank you for grabbing the gate belt. So we have the lines being managed. We're now ready to begin our supine to sit transfer. I want to first begin to make sure we have the bed as low as we can possibly get it, so when the transfer is complete, their feet are touching the ground. Okay, we're set. We can now begin with the supine to sit transfer. As before, let's get the patient to assist you with reaching over to the opposite side to begin to roll. Roll the patient onto their side. Still assessing and watching out for the lines. You okay here?
Mm-hmm.
Let's get the patient's legs off to the side of the bed. Okay, Ms. Doe, we're gonna come up on 3, okay? 1, 2, 3. Good. On completion of this transfer here, we want to reassess the patient. As he's watching the lines, I'm also checking for the patient's chest rise as well, make sure they're still breathing, see if they're still alert and responsive to you, and also checking their vital signs on the monitor. Ms. Doe, you're okay? Okay, good. Now that the patient's up and sitting, and they're showing or displaying good sitting balance, we can then get the gait belt to put the gait belt around them. Okay, Ms. Doe, we're almost finished putting this gait belt on. We have our helper supporting you behind you, okay, so you're okay. So we now have the gait belt on, we have a supporter behind. Before we begin the next step, we want to then check with everybody that's involved to understand the patient's not going to be moving, lines will be moving, so this is a very important and integral step. I want to make sure that our helper here managing the lines of the RT has adequate lines and understands the process that's coming next, so the patient is going to stand, pivot, and turn this way. And also making sure you, the primary mover, are not in obstruction as well. So once we get ready, you'll come on this side. Are you doing okay here?
We'll have enough slack to put the patient in the chair.
Okay, perfect, perfect. As you can see, coming towards my directions, I'm not obstructing anything. I'm not in a position to dislodge any lines. That's how you want it, having the lines on the opposite side of where you're going. Okay, now we're ready to come this way. I'm gonna have my second helper here to be able to protect the patient's posterior. Okay, all right, Ms. Doe, we're gonna begin with this transfer. As we begin this transfer, I'm gonna stand the patient up. Once the patient is up, we begin to pivot. That's when you can assist holding on to the back and the posterior of the belt. All right, Ms. Doe, on the count of 3, we're gonna come forward, okay? Or we're gonna stand up. 1, 2, and 3. You okay? You okay over
Yes.
here? You okay? All right. Good job, Ms. Doe. Okay, the chair's behind you. We're gonna begin to come sit now, okay? I'm going to take over from the lines, from the RT. And from this position here, you will just reassess the environment, make sure all the lines are stable, and you will have to find your way safely out of this. So we'll lay the lines down while you're in communication with everybody else. We okay back here?
Mm-hmm.
Okay. So the safer route from this point, I don't want to go this way, there's nowhere for me to go, and we see that the vent lines are going this way. We'll just re-maneuver these IV lines in order to get yourself a path out. So we have the patient safely in a chair, vital signs are good, RT is managing the vent settings, the patient is still there, the patient is still breathing out. From this position here, we can rotate everything that we have here to where the patient's chair can be turned in the proper way, depending on how you want the room set up. I'm going to begin to slide this bed over to give us some room. I want to minimally mobilize this ventilator, so I want to get everything situated around it. Now that I feel like I have adequate room with the bed, I'm going to lock the bed in place. It's okay if I move this to the
Yes.
side?
We have enough slack.
Good. I shifted over my vent just a little bit, along with the IVs. I'm going to unlock the chair. And while your assistant or the RT is managing the lines, we can now start moving the patient in the chair since the wheels are unlocked. And there's nothing at all wrong with taking little steps at a time to make sure everything is okay as far as the lines. And from this position here, you have the patient right near the bed. We can lock the wheels. We can then set the lines down, reassess the situation, monitor the vital signs, look for the chest rise. Make sure, again, that we're checking after our transfer is finished for the settings with the vent, still secure with 2 fingers. The settings are still the same on the ventilator. Let's kind of situate these lines to where you get allow for ample room for that. So I'm going to hook these back in here. Give a little leeway to allow for slack. So you see this extra room we have here. So if the patient wants to turn their head to the left or the right or reach for something on their bed or for any item on their tray, they'll have room for it. Same thing with the lines as well. So giving ample room for the lines here, and also a check with the respiratory therapist to make sure everything looks safe and situated as well for things that I'm not primarily managing. Everything looks safe?
Everything is good.
Okay, I then want to let the nurse know the patient's sitting up in a chair and how much slack I've given with the lines and where everything is positioned.